Ktrh TV Omurabu Wagusi.
Biamano nainde omwanchwa umuligiriria Ktrh TV. Daktari asha dunda ndani ya mjengo egere tuchaki nkwa naye masemo nyoralero no bachenu Tuesday gose Healthy Tuesday asoch tuwaligiriria igoro yo bachenu boito na koruma mitwara nkonya koba tips inkenke igocho kwane kyango bachenu mbuyabura simechi itokolinde bono iga nyagitari kirasa studio mwabole last week mangana yebikorobyo waiter suicide thoughts rising cases of suicide inkiyego gera abantu lero bakale guita nantu ba waiter barabo banyene ayonto yaligeriye kyagara that's a mental problem togo chikuligeriye kingese kyagara last time ntwaligeriye mangana depression twalingina daktari ga studio enda bange mukanda in box mugatebanga lera nto tokale guikora nkigosekera abo mu chando is that a mental problem goseno monto wancha ayona tochikuligeriye segeke kerebusigo karibu sana sangana into Ktrh sensemo ya online na otole na Ktrh TV abu Facebook na bayigo na otole Ktrh TV asensemo ya YouTube na itira bakonyara na Sara Ontita asensemo ya Facebook account yane bayiga SMS number usogotomali huko wose ujumbe abogo tobwata wetera 0735 333 000 0735 333 egere kerengere kia oto ega abu igoro yenkwana yeli tukulia lero kabamo na intwe wikomo elio bwege pindi chilaini chetu tuigoreire online tuigoreire ne link ya tomiruga bungo share tuli na shortwell asinchira yobekira no kigima. Karibu sana daktari. Good morning.
Good morning sana.
Karibu sana naende. Happy to see you.
Happy to see you too.
You are healthy ndo chimbiole tulipo daktari. Karibu sana. Wanjumule na boranya wale tuumirane naye baumirane naye iga akirende nerebya koraba manyinga na kyokoro kwa kabisa egere to munyako so sensemo yenkwana.
Ambiamono Sara, ambiamono omwanchi omurigereria na Ktrh TV mbiamono soko ngarigania so muroberio yo nanderero nero ko batago semya abantu baito igoro ya mental health na amangana manga wa affect abantu yeto yako bongo samalieta nkuru ku Rodgers Omuya psychiatric clinician ku Kisi Teaching and Referral Hospital ntore gaigare aro tukwanere mona mangana mental health mono igoro ya suicide osoko erusio bomoyo
all right mbia mono sana Dr.Rodgers Omuya munyagitari mangana mental health ose mental problems evions no viko banato tebeti last time the difference between mental health and mental problem was mental illness. So funny my thing abana bale class manaba ngaini ntokuna kwa naende back igoro what is mental health, what is mental illness ayon sinata tebetyenyo kwa lege very keen no ya manyete kulinda daktari tutara suka toswa ekyagere ngana itene na nigoro ya mangana suicide kulinda lige gazeti ya Daily Nation na rachi proposal munyagitari mubwate especially classic kumbikia KMPDU naro you have so many proposals gochia se chi department chowo chenu na igoro naro che magomo yarengi Kenya ngima no inkisi tetigirmagega igoro yo malalamishi munyagitari babwate timeti in less than 1 minute kyagere ki taligera to kwanira girende no munyagitari na indi binte mbire concern ya ino na bogora kwanira ke igo chi proposal narora ati aba banga batagete doctors baba recruited annually buna disciplined forces.
Okay. Ambia mono sana Sara na ndimbia mono soko okoreta libori elio aslit kore goronto abwate umorobekanyo peaceful demonstrations in Kenya from all unions of health workers not only doctors. We had twabwate chi demonstrations in Kisii and in Nairobi. In Nairobi, demonstrations here, the main issue was to stand against police brutality.
Yeah, yes.
Yeah, the KMPDU Secretary General was injured during the demonstrations. Nekiekea bantu twajitamo utenena in solidarity with him. And again, tukende as a Kisii County, ntobwate some issues chitaraba resolved, including employment of more health workers, promotions abantu mbali ba specialists so many years ago bataraba promoted mpaka boniga, and we have UHC staff abantu bali bakora kumuna UHC staff ba national government batamanye tinka ibago chafte contract yabo yerire kyagaramba bete promise dingo chikoba bari absorbed go chese serikali. Those are some of the issues and employment of interns. Actually initially ya renge kiro monta kore school within a very short duration matukamake babere posted into internship. And actually interns play a very big role in hospitals. Both clinic officer interns and doctor interns, medical officer interns play a very big role. Bono tikatoto yabe kunenya kitari yeto ya Ktrh. If we don't have interns, ngakinere toko ganda tutawati interns. Actually, that's overwhelming. But kire interns barororo, they make the work easier. As much as they work under supervision, gokora bali gasia be ngororake. Agera abanyagitari ababandi ba specialist ba concentrate ya sega asiende kubasomi na ababandi ebintomire buna collecting samples ko ire lab. Yeah, ko take historical patients kable consultant tiache ko room roire go say and specialist tiache ko room roire, so they do a big work. Actually they work 24 hours. Lakini bono tima itinke serikali roche gose na kumincha roche atate tiko posteria bantaba egere bache go konya chinye gitari cheito.
There are almost 1,200 nara buna gazeti ya Daily Nation yale kubolia. Of course you are amagania, I know sebiombe byobo cheno are very much genuine. Ono tika the relevant department be mukige tambukiro propose cheno bachirigererie chirichira nyalikane chikorwe chirichita nyalikane with reasons na umoko reason together. But so far tunashukuru sana asinchira ijobo ikiranu ke gima. Asante tole no munyagitari oito Rodgers Omuya kurasa nyagitari ya Kisii Teaching and Referral Hospital uri kura kwanira ke iwe kyagara ina wausu na kikwaro chirete basokerete litukuligor nende still KMPDU naro chiarwete 7 days.
National strike now.
Yes.
The whole country. Yeah.
Singima. Anyway, ayon sikage ndoto mancho muligeria bano tiatuira na senkwana ite masemo daktari. Ntorucha matuka bwangu iga rising cases, yani bikoro bya bantu wita byabire binge mono as compared no nyena matuka magega uchagira mutinyu mutangani mpaka bone gabona tukali kitari kisano nemo mutinyu yo gatatu abantu abangi beyitire bona kitukubolinga umuchando n'orulyoyo
mbira mono sana Sara. Suicide ose kwerusia bamoyo ya beire gento kia mentekire ase yaito mona ase county yetu ya Gusii ande obutukingo tebabolenga in every 40 seconds umuntu nkwerusia robo moyo in every 40 seconds.
Seconde merongene
yubono nensengi globally in 40 seconds umuntu naro yomo irusiria robo moyo ono muno tokunya gukwana iga umuntu naro irusiria robo moyo. So meaning umuchando munene obwenta ko kuligereri wase agare agatunyare kumanya nakitoko konya abantu baito. Mono ekento koru COVID-19 yachaka na liye mechande ye menge yachaka takorekana ngonyi butami ngukwana ndigoro ya COVID kira tukukwana kiagara before COVID ye bintu binge byalengense bantu mbamaite mental illness ninki alibata betabona bagaka bachakire gocha nyomba twachakire kora bagaka baitu kumbe konyemba bwate mechando diriba begete curfew muntu tari kobera isko bwakonya bali goika nyomba jinsa chiarire bone bali goika mapema naliyo mununa achakete koligere ogako yone talibia tukalienda gochorara. So ebintu ne binge sana bikogera omuntu olengera likwerusya bamoyo na ande kiratoko tebo omuntu ikira asa stage eri okwerusya obomoyo igo oratemire otemire sana kurwani abintu biri bimuchandite nandi omonto ikire kwerusya obomoyo mone togoteba tategeti gukwa atagete gukura the pain osobororo buri ateire o emechande eri etere nera atagete gukura but in the process onyora oirusirio obomoyo
right igonga it is true na maene ebanto kwerusibara magimasa matukabwa ngoiga nandi tali gusioka usitali Nyamira usitali Kenya kulende ensingima ono ine daktari ntobwate risk factors to suicide montara aratebenga kiki kale do we have such
yeah ntobwate risk factors che monto kwerusya obomoyo nande the first risk factor use egento kelikira abe ko monto airusya obomoyo it is being a male gender kobo musacha ya menarat abasacha mbare ese risk ere igoro kobo these other gender kwerusya obomoyo egento gya kabere being lonely ose being single unmarried bantu bali bakire emyaka eri yoko nini batara bali at high risk yokwerusya obomoyo number 3 no gotwara an underlying mental condition abantu babwate mental conditions and underlying mental conditions but at risk yokwerusya obomoyo especially abantu babwate depression bali babwate risk eri goro yokwerusya obomoyo ntobwata abantu babwate chronic medical conditions abantu bali babwata amarwaire ali atali koera
amarwaire amangira
bali ba lazima anywa mali okerenga koro omuntu ngo ikarunywa eri ogomba koteba anje bono narosire kunywa mali ogaya narosire n'obugimobo ne risk factor yende ne family history omuntu naro koteba bali ororeri rwabo no kwerusya obomoyo ono ntobwate mutongotwara tore family history montonyo yegona otemete kwerusya obomoyo kero kwere history yago nkubori ore naki se family no muntu naronya gotema kwerusya obomoyo so a family history go say genetics nku play chire na chire role another risk factor is alcohol and substance use abantu bagutumia ebinywewo byogotindia mbale se risk eri goro sana yo kwerusya obomoyo basically those are some of the risk factors
whatever cover a male gender what cover female gender we have to
oh no tiganda eresere goro yakoba male gender osokoligereri statistics bebe ese obutukibori bwakoriru worokiribu n'abasacha abange nkwerusi bare obugima kubwa abasubati tukayibori asiki abasacha abange bakwerusi obugima kubwa abasubati abasubati abanga dara kwerusi obugima ngote mari gukwana n'abantu woso experiment o eli attention seeking ritangani na kyabantaba na kiba tigango ndatema drink bakora banganchete you so women so most women kira bakogenda guchigo go attempt suicide gose gotema kwerusya obomoyo they do it for they're calling for attention attention igete bakurangeri ebuchanda noli mbwate monkonye nekeki okorora abasubati lakini umusacha oikira asa kwerusya obomoyo togoteba aise kubuka nandanyore kale moyo nabaraga niko kore gento kende ekebe egareta abasikorrekana so umusacha ikire stage you know muntu temire sana and again abasacha due to cultural ebintu birito believe it musacha tabwa ntiko kwana akorrekana to be weak umusacha tabwa ntikolera onyekira asiriri umuntu anchete obeko oborobori bwensime yaye bokumobeka at a very high risk yo kwerusya obomoyo but nogenda ndonsi asabantu bakwomboleza nabo kuligerera orora abantu bakorera mono n'abasubati togonte imusacha tabwati bororobori nabo atoborora kini abo gachete takunyara kobosoki okugacha kolie bintu abasacha bakugacha mono na bikuba bekata ni increased risk yo kwerusya obomoyo kyagara togoteba a problem shared umuchando ulio is solved umuchando ulio bwatekera kwa kwante no monto okonyo engebuna
kwa yo sonzo jake enusu
bona basubati liri bakwende ebyombe bakwana ebintu chichiro bane gukwana ebintu they relieve themselves bakwiguba abeire buya n'umusacha tigabeke mbakwika bono chaka kunya koigambi kyagera usinyiru kabisa ningago te imichando yae kago chikote yoyo baragenda bamukwane batebe umuntu oyo ni uleta narali bakuruka basacha
Biamana sana daktari. Wanchi muleta na daktari akuruka Rodgers Omuya tukwanira iguru ya the rising cases osomo barogokina bw'abantu kwerusia ubugima twarorrenga gatika bere abagaka nabo bakwerusia buguma mono karoboringori bwakoriro mu barobwa abagaka ni gorigoro monake wono twarorrenga into geguchangia mono is the gender factor ontakoranga ninje mbukuriti musibo oyo inje tintakeiriko koleke yani nabwo babwate mechande menge ande bagukiri twara basubati barabo we speak a lot go share tole but rende it's high time no nyina bagake keromigire tiga gusoka riyo muntu mukwanira ngo ikatore gabo ngana kitora kore tukuru muchando yo iga na daktari nyiko batari bolyo nabo kuri beka gwitera se number 0735 333 000 osasa nsemo ya Facebook otonyole Taya TV na otole live na YouTube na otole live buna Taya TV kose ondigibu na saro Ontita asensemo ya Facebook boigo na mbalina sangete posta mbali bantumirita mabuli gwitera se inbox ngo ya somande asegeke kiribosyo daktari anyare ko ba gako yairaneria daktari twarore risk factors wono tumina arorenga everybody's at risk ntubu ati unatotebenga abasacha na bali abana nini like all of us nataka kubolira boli lakini neira tayari neira already it's like kero muntu na bale a candidate ya suicide ya suicide
mono sana Sara ngende kikwaretira ati everyone is at risk ekina kibono kego konya abantu baito bamanya timbo ntikunya kujaji umuntu gukwana so o mention iri ati na rosire no bogimante tukwerusya bamoyo ntutwensi ntora at risk kero umuntu na at risk yo kwerusya bamoyo kiagera tori komanya na bengo boroire kera bogochero umuntu tori komanya na kibogocha aseigo kero umuntu agochera ko gotebi na rosire no bogimatiga ko mujaji tiga gochaga ko muchongeri kara mutegererango kera nae kana buraike ubuno muntu yasaikire seigo tema gotegerera umuntu yo manyeme chando ke yagwetera ayonyara ko mu advice kera egento twarorire mono psychology orokire kworokinga umuntu yo egenda tagetezi just someone to listen umuntu amategerere tu moeno just moeno NHD kai komicha guchoka motegerere akweresere without being judgmental otari kumojaji nonye motegerere oyunkia ko gotai from there onye tokonyara komokonya kinye gitari nchirangi ntubwate professional psychologist baranyara ko babakomukwanira bamokonyo anyara ko bakagokonya kama pema nandikira to rusiri stigma yabono kira to manyire na benge to goteba kero umuntu nara at risk yo gutwara malaria inakiye kyo umuntu atari kujajira yo umuntu bwate malaria ati aho yarwara malaria Tuisu komanya tuansi ntura at risk yo gutwara umuchando yo dokunyara kujaji bainto baito na stigma eri ekwira nanse stigma kira yaranire abantu abange bagochinya gitari bachake open up oraba sacha baita sebinyoro bakugenda gukwana manganabo tushaka gutwara men baraza siasa basacha bagukwana manganabo egera umuchando yo nyara ko bagokwira nanse
kogokea mbiamano kigima abantu abange andina umuchando ruere tabo ondra bakoretera umuchando then kwa judgmental from the beginning gaga ndato gwara already ayo umujaji at the end of the day oro kama kumtenga na already nayo ripobe kana kutegera umuntu take your time
ati kararo rangu babantu unabachandi gitenge gitari kararo rangu umuntu uriero unyura maryo gemyake mengi antanya ku give up tiga kunya ku compare umuntu ore society tiga como compare na abantu bande we all react tutwanse to react to pain differently abantu mbaraga pain yagasini nikaraba bekense mbale baranyare ko kubugori pain yenene kwarorire ngobona tutiga gote abantu baiturigerera inyare bayere urware tembaka kaputurwa magoro inkiatanya kolengera likwerusyo
by the way
tutiga ko compare umuntu kirachire handle imazani individual bunachero manyene surround your conversation aso muntu yo manyene onye gotete ko mu encourage na mangana ye biblia ebina byora mu encourage na birabyo lakini ko chaka komotei buno uri achandikete nandikaro tukumanyori wero obutoire bunatanya kogotenki gekogenda
gera. Yes, and you never know.
Bia
mono sana daktari asamangana amaya. Kero kende mbinto kiebire nde turarigere tumanyenga oyo igo twarire birengererie bibiga tagete gwita bono ebimbiri tokoroka signs and symptoms so warning signs montaro lega kararo monto uchakire gokora iga amanyenga riroria binte bibia chenchire.
Okay, Sara. Ebintu mbire bimanyererie bitangani umuntu uranyare kurigereria. Egero manyenga umuntu oyo igana abwate umuchando gusasa ikeire nkokora legente kebe. Number 1 umuntu ko mention suicide igenda tokoroka buna suicide ideation. Umuntu okunya gukwana nchenko irusi ndobo moyo. Chinaro sire no bugimo. Ekine kimanyererie getangani. Don't take that thing for granted. Umuntu tabasigo chako tenko irusi ndobo moyo mubuli nkito toko koletere ngoli ratanderati usenelio goli ngombe tatabinki utegete to basigo tayo umuntu igo kero umuntu mentionire gento bunekyo ige bintebyo in their subconscious mind ebirengereri byabo ebine ebirengereri birororo lakini bono ikirasi gituchakire kubikwana igora atwarire karengereri ekyo asenga ki bono ikirasi gituchakire kubatebe ekimanyerero gya kabire no muntu go isolate kurwa sabantu bande muntu onye tutebe obwata basani uchakire gutiga abasani bali obeirere bweka ikiaga gatatu no koba irritable gose easily agitated akogechu bwangu tutebe onyo Ontita abana baye bona mwana guchikumukwanira omutogonyera gusomwa kwa mwana umuruta gucigari egento muntu yatagete atageta abana babaye gose familia yaye mwange agare kainga kiago ku baba chugutwara kwamboleza mono batebe kwanza tatwanjite achake go create na miti ya ruasi bali mono na kibaho kolera igo irritability na agitation umuntu akaonya kogachugurio ke binte bisinini bya mogachiri egento kende no gutatwara concentration umuntu no mukwanira konyora arengeretie aliense ngao tutebe buno kunya gunkwanira iga namanya gukasigate natabuka nateba obe nakikwale kote kwarorire birengereri byaye byachire atambe ebintu bindi nabakorera abantu bagunya gupo umuntu agupost chaka gupost ebintu bitari kawaida status chaye gose social media platforms cyose abantu bali babwate kisimi gose bara internet ngo chaka bali gupost bakwate babuna bayetere mechando gocha ya mono for women will post so that they can get help batarachi kuikira estate but most men barabuna bogu chaka koroko gachugo kwa kunya ko gachugurio kalioka another thing no muntu go chaka engage in reckless behavior ko chaka okole binteta bihe bintu bitatale gukora tabonye tali kunyuma ru osonyo ru kunywa maru in a civilized way ko chaka kunywa maru yani
ari ararete riski yo kumuita
yanywa muita amongenta muite ose kende gyonske mokole kanire kratinire atale pali gali mwake muite
kera kwa no kurundie gali
guso arundie gali agende muite kero umuntu achakire ku engage in risk behavior including risk sexual behavior ochakire bono kugenda gukora ibintu na another musacha kugenda na every lady anyorire the engaging in risk behavior it's one sign okira kwa rero mugaka achakire kunywa marumono kubwa unarenge achakire gukora ibintu bitari bya kawaida dengera limbi muchando kyo muntu yabwate ade asibaro chinagia kegara bonera asare arocho bugima bwaye bwikiro moelio and they can do anything kirikira abarusia se asensei those are some of the signs turarigereri mono nande ngotwara turabandi bagotwara sleep disturbance ya muntu nabakubuka butuko kendo karanse kirogo kirako nyora kindi nkiya gukora ikaranste tu ebirengere bya turu kumanya nkikegenda tora kini mono is the suicidal ideations or thoughts chichiro bongo bwaimi
alright nganchire daktari nkoboli karokende omuntu arachaka kobeka his house in order ate tukulika gosene will ate tukubange ibintu byaye nakiora tofautishenga oyo maybe tali birengera byo wita ose no muntu tete kobeka house ya in order metana bonya kutusinyere sana
abantu barokonyora bagwika bachaka gupanga ebintu byabo babibeke buya lakini mono bali okonyora bakora igo bali bamanyira ati I have a terminal condition.
Okay.
Uroire mbwate tindo chikose ninchembe nseye for long tiganchaka kubeka abantu bane buya kwarorire but still bali suicidal like into depression severe depression yere beyond otema bali kokora ebintu ebi but mostly bali gutwara motivation buneyo bali muntu suicidal ororo anything that will come na tabanga kende gionse they don't care kubeka bali family yabo buya bamanya gukora ebintu abambali bagocha bakwanire family yabo mataikere gento gusorika suicide note.
Okay.
Oba tigiraga gumanya kugenda kwirusia obamoyo igotoli kunyara kumanya omuntu oyo kirali kaige wilie kera no nyangu singise gochanta ye familia ne bono njutwe karanse ntitukolike will abantu baguchaka kwibulia maswali ya mangi but idea likolike will terigento kebe onde bwensi na bakolike will egere kera bugimo butumanya retininki kerabe twensi ne sabali tole na okutakolike will lakini ase culture yaito kolike will igwaye bono na abantu kotegareti ense na
makesa
sai gotoli kunyara kumanyiriri muntu ye will yali ka izit ese sauria somire ebintu amanyire ense bono muntu lazima alike will gose gototigata gete
is the same as kwenda na even your values gose ne ensa kwa umuntu ntukebya chete you are giving out gifts
yeah
all right
bali bagwike bachaka kwena na gose ochaka kwoni among the reckless behavior ndata bino gochaka kwoni amari maina hauli muntu nyakabwato buri moto yababono tigangoni ebintu byenseye chibese chama tukayantigarete amakendi alafu kwere ndwense
Mbia mono asogoto some of the warnings ekero monto atagete koro bilye gwe koro sekere birangereri byo gwita bya mutawalira se birangereri byaye igo bono nere nkwana to kwana bono mambia igere nkwane ndito igere nkwane gwenerete kuiro with a lot of omuntu ubona tukuje buguri kapise kyagara ebitwa birorire mbiro aroro isikuriga nombono igana bokoro omuntu birangere bya muchiri be daktari oitire mokaye oitire abana boitire bono mune kesi ya silibueti ga Bomet County mongwano li Robert nabaita abana munginoye nera kamanya korwa yekora so ebine bintu bire asetore bintu byanyorire abayiri bawo usana matango gochinga mwana omumuro bintu nagaitete mukaya nera yeita so nakikiagera giacho on the right time togekwanere with the experts batutebinga ebintu mbiri bitugwenete kuligeria ina advance egere gosentoke yo muchando yiga abantu kuna weita
daktari Sara chinsa chinde pole asogo interrupt
yes
chinsa chinde tulikomanya muntu gosengo cyari kwerusya obamoyo osena bwate suicidal thoughts bantu mbali bakubuka buya bagende gasi oike gasi orwaro genda kwibwati ochire erusirio obamoyo mono ngoteba tole umuntu nabago chasmerie gasi but inside them they're fighting so many demons yeah umuntu nabago chegasi igo tema ko treat your people who said the people you work with well kera tuli kumanya nkyo muntu mechando kya wetere imeyaye bono muntu nabago chatatebe abako report gasi acha seke muri buya smile but it's a fake smile kago soka gali mwigwati agenda ogoreriogo oburukani na maru onyo ogenda igo.
And by the way, daktari nganjira because ekesinkere twa kora chinsa machiri chanya machi asamangana ito amaya musachi okonye ba rubiri gokore nyangi ne partner yayo mutenyo yo kane to goso mutenyo gocha ngabagatiga na marogoba then in the morning akanyoro kengen kesungeti that is nyamachi junction so ya ndeta nkubulinga kero kendo umuntu nabe taoro kitis warning signs lakini naende kole alafu konyorore buna abago ita usene familia yabo nabarobe ita kwanyaro sinabuli bagatagaki hakwa meonyesha any sign ngana tagite gukora abantu baye na ende no mwana urengo muya konye taorogeti any signs and symptoms so how is that possible
and sara ntagite nkwanire gente kisane kiwa kwanire ndeke abantu bago chabate abayani taorogeti kende nonye ntwe twanyora arengeya umwana urenge no mugoko no ntwe tukumeti buna mukumeti. So let me tell you, tigamba tegenteke mo. omaito bwanchani ense bwasirire bantu mbanchani buna kale twanchani bantu mbali butarira na buna twagatarira kale obwanchani bweranire ense abantu banchire enibo banchire ebintu byense ko bwabuna banchita abantu babo osaba iri babo bono omuntu concentrate mona se nibo mpaka tali ko concentrate yorara mu murominto squeeze tali buyo chakire ko change and I'm telling that you that from my experience na arorire in my years of practice bono ese soli batali ko murigereri buya barabuba maite our brother or our relative is okay is happy lakini onye barenge very keen na onye banche to muntu yo mwabo they could have noticed change in behavior ebintu birebe kebike twagoteba biko chaka mu change onye ndiriba mwanchite boronge osebali kumutarira baumera na batwara family meetings muna kale twagatwarire twagaikaransire twamanya oyo muchando kyabwate oyo nkyatara umwana oyo nkyatara achire skuru azeki umwana oyo yari nkamba kaboniga we don't have that now bono muntu agosafa in silent onya gosafa in silent lakini kago cha small yakubatei kire ntombi yakere mbuya toka ndrete abantu bonsi mbuya bali na nda akorra ginko bachiko batei mechando yani bakorra nko bachandande so bintombi nko basaba bono sara tigango tei na baligereri baitesi bali omuntu yo na oikiro irusiri obo moyo there's a trigger yachete kabuki mechanderi yonse konyakirire time yaye atali gukwana na anda so muntu renge kini lazima na roche this guy is not doing well actually umuntu re suicide lazima in their life baro kiyo mechandegete even others also kolekere dichisi michabo they go even to google the best way out
to kill
nchira kinda tumierie indagende bwango batanyale kuongirani warolire because they've done a lot of research batemire kiregento andonye bakuchikoligere lichi movie nchire chikoroke binte bibe yaba encourage kabisa sometimes yabantu bali suicide onkonyora bali motivation te umuntu ogubatla suicide thoughts for long aisikoligere ligento gete nabake ko motivation yakole gento kelirimo sa zingine na beta be trigger na baranyore motivation kuri wasigete ekogera bono nyo yokoraiga na inchindo che na bongo kolegente ke succeed koraiga na kiki togote aba program chire chitabwa ndikonya koligere ligumono chigocha charete mechande mengi aseiga abantu baito onye nto kunyara wancha nande ngote yabantu onye goteto manyo muntu nkiare kara ancho muntu yoritangana you can't know someone if you not fall in love with them kara mwancha litangana lionyara oranyara kumanyita biyo muntu yoiga lakini ochake ko judge blatantly ati okonya no muntu olebia inki akorera iga ati otogoseire bono mwachakire pamurukiro muntu mube ati are selfish nini ochire so igotiga tuteme kurigereri closely abantu baito mechikibagwetera
biyo mono sana abwanchani botawale naliyo kumanyo yo mino manyete onye twatiga na gose abantu bagora mostly December wano oroje abantu bagora the mostly December last year na ende bache bakore na ende gose na ende December gatia nkikwamanya your brother your sister your father your mother awetera bono limu atigana tamogogete hono gote haki mwana mtu paka ritwarenga mu wa okay so in behavior naliyo kumanya kwa mata inki bono litwa korera naliyo mutaka open kwanya banta bwata suicidal thoughts for example is there any treatment or therapy sinchirororo abantu bona babara akonyekirinde
bia mono sana sara there's a way out inchira nero rasa abantu babwate suicidal thoughts nandi na bako babago konyeka again to bara akoreri tangani is the first thing to whatever is opening up umuntu atembire ncho monyene na sinyiru ke akonya koinyenya itotokoroka self harm okoinyenya kuri actually ego bakonya ko relieve the pain area me yabo I don't know if you've seen people who've been harming themselves
koinyenya kapisa
rusia manyinga kera rusia manyinga ali akorobere relieve yake bono ntopate so many ways of treatment egentege tangani onye suicide thoughts yechigo so evidanga libibyo ko rusia bo moyo mbibe ngokole rubare counseling you get a good counselor na bakukonya mo korege ntokoroka psychotherapy amoro iguru ya coping mechanisms and then the join support groups also I say byombe bira asibakonya gukwanira continuous because onye umuntu what the suicidal thoughts are at risk. Actually another risk factor na eba ko goteyo umuntu kwerusya bamoyo is the previous history of suicide attempt. Umuntu who attempted suicide na at higher risk yo kwerusi nando bamoyo. Ase igomba kwenda konyora continuous support na kiki tobwate support group nonye nketiare support group nchire chigo chago chaka bwango igacha mental health already ntobwate cha abantu babwata marwere sugu una diabetes hypertension ntobwate support group na nero bone randa we y'abantu babwate different mental disorders abantu babwate depression group yabo kando era twabatuko bakwanira if it's every week baba bago cha twakwanira manganaya agera bamanye they have people who love them, there are people who support them, there are people who are ready kubategerera abantu baro bari ready babategerere agera banyara ko bago tigibirengalie bibabwate.
Biamana sana daktari, asante. Nindoche abange magendete kutubwatia Victor Monda, asante mwalimu Thomas Michira. Biamana Omurwa Oigo Moses, asante. Rebecca Bochero ino biamana sana. Wycliffe Morara, asante. Nimbarochi aberi kibaraza biamana sana. Mbara igabako na kuponga sigi pindi akurukwa Evelyn agotheba kurwa suswa nimbabwate tibya wetera senchira ye mtandao kwani ya daktari this is the right time okwanira igoro yengana ya suicide egerto konye ikiari yankyo biamana sana Evelyn kura chinse machira chia suswa na Correlinet nera agotheba kwani ya daktari amaiga mangi is really a mentor and expert abwato bumanyu ngase ensemo yaye biamana sana agikiagera tugatene last week minuto tari gutuka tugatebanga gukonyora chinga kitu manye gusanga amonaye. Asante sibali mogendrete gutulikira gwetera sensemo ya online na boigo SMS mbale daktari karona sangete poster basoete into my personal WhatsApp account bakandikira amabuli atari make nataka obairanirie naro yomo okurukwa Linda she's my friend andikira tagandavinga what should I do if I am struggling or someone I know is having thoughts of suicide nkiara kore anyoro muntu uri amanyite ogo struggle nibirengera byo gwita osonyo rero manyene struggling nibirengera byo gwita osomusani oye nki abwenere takore
ambia mono sana Linda ai ntonda matebi if onye ka bwate birengera byo gwita osonye ka bwate omusani wate birengera byo gwita actually one country in hard economic times abantu mwetera bali because hard financial times is another risk irabe komonto arengera likwirusha bamoyo kyagera bono nyatari kunyara bu fulfill roles chae ninki akorankiara akora sensei and the relationships to ebineba kukwana problems in relationships and marriages inkogara chira abantu virusi bono Linda kero omuntu abwato muchandoyo the first thing onye korale nenya gitari osonye korale no muntu orago konye just get someone that you trust rigyo muntu liwa minute mono ngo prefer omuntu bw'ikanisa either mu pastor mu sacerdoti kanisa irange naye just share with them and squeeze yukerato akwanere kale nonye psychologist tarapa chinyinge the church used to be the na ubale ko abantu baito counseling ekanisa nero yawe ko abantu counseling aseigo digyo omuntu bw'ikanisa kwana nere litangani ara okora counseling for some litokoroka psychological first aid what is psychological first aid and then from there they can refer you to a psychologist because into ateba counseling na beko gokonya lakini kila counseling yangire ntubwata mariogo nande muno kiro muntu ikire ko rusio bomoyo igo ekemi konkere kyo bongo ke koro muntu ba comfortable ke koro ku serotonin maboko nyore kemiko kiriga achire nsepi gekira sebono ngeta nkonyara kwirana lazima tomobeke asa marioga gokonya serotonin levels chiche igoro asenge gentara akore no korigyo umuntu ranga mo kore psychological first aid and then from there amorify gochiase nyagitari nande ntubwate byombe bibyeto biganda takokora voluntary services bikokonya abantu we actually we have a mental health directory umuntu akire sub county ya gore kire kwanya umuntu bwate suicide sa into bwate kire sub county ne bwate for mental health person or responsible for mangana mental health iko kire kwatwa umuntu bwate suicide into bwate mental health directory ni nchenshye na sara eronya rako bage kunyena na bo muntu awakasi na mbeyo because suicide is a psychiatric emergency suicide umuntu or what time suicide that's a psychiatric emergency lazima kwa kesi mi agatatunyara ko batoko mukonya umunyigitari natanyara ko ikoro na bako mukwanira through assess mi anyara ko baga ko mu encourage alafu akonya gochanya gitari
pia mano sana my friend Linda nimetenga kwa nyodre libolyo oseli chibu aseli bolyo ya watu metewetera sensemo ya WhatsApp mega yokorora e posta nga daktari ngo chalengerero ase e studio igo nayo mwachimanyo ko watali bolyo igoro yenkwana ya bono mambia totumere wetera SMS number eyerega wa CTV yao 0735 333 Dr. of late okonyoranga abantu bakulika asana se mitandao social media mtonya batanga leo inaweza kuwa siku yangu ya mwisho my guys fans umuntu go joke but gakolika all of a sudden namatukuma kigakwera kwanyara umuntu uyu werusire bagaso kule so kwanyara onde ukona wateba unajua mimi natamani kifo na kifo yangu naona itakuwa hivi ndio kwa kwanyara imetimika na mna hiyo through social media so muntu nataka kwebulinga if I see a social media muntu bekire suicide thought yororo nkinkole
ni libolo liya sana sara kira kwa umuntu kira abantu no bago post joking but again to muntu comes from their mind from their thoughts bono kebeka and written into
yes
as a social media what you can do when you know musani ogo kindly try to reach them tema kumwakelesi mobile ngikwa minute kiroko like but one thing ya umuntu yo they lie to you that they are normal if you ask them just once ono umuntu likire mwakelesi mobile ngikwa like social media I was just joking just keep insisting Motebi I want us to find time to ikarasi to kwane because some jokes are not good jokes ntondere gochirera as jokes agaro ikaranse kiramo ikaranse no muntu ebona boko manya this person really meant what he was writing muntu wegentali gete negenta minute na liora nyare bono komokonya omwa company omwere nyagitari ntwata yabete kero montaro ari tobongo the brain is sick no bongo no bako make most decisions when the brain is sick you can't make a decision bono na yora mokonyo ebirengere lyo motebi nchubono tutare tokane to psychologist na ndo siko bakora igo they really appreciate that umuntu wa appreciate atebe at least inkwara I was going through something just by the joke that I wrote on social media kwangirire arokane no munyagitari they will be forever grateful to you.
All right. You go, I just check them up. Baikange, korange, baikange, usumekora speak to them.
And again, I can give a story. So many years ago, I think I was young. There's a close relative of Koran Tebi. Musuvati olina yaronkonye tunangana irusitio pamoja reason ninki arenge abwate birengere byo kurusio pamoja yagachaka mubori omwabona kire yaronge buno changanyikire na kyoriga kamubori bori akamuteye buna ndoche tolibuya muteye yarabuna wakwanire ndoche buna na inche tindi buya akamanya ko recommend gatabu getamwete agasoma litukeli okuchanganyika kwa abwate alengereti agenda asigitagore ryogo anywirushyo bomoyo but a friend akamorora ebintu biri twate bibimenyererio
science
abwate kiramo recommended gatabu keli ikamokonya mbaka actually akamoretera monye na akamorera gatabu keli kamotene nchi gatabu kingi ankonyete it's a book na ibire litago kiroka but something kuchanganyikiwa kiege Swahili kialenga since then mbaka boniga the person is always grateful to that person. Onyo tando chebuna ninchanganyikire unanga ncheboni ngatingiyo.
All right.
Warorire igoti gaturigereria abasani baito.
Yes.
Saro nyakona rite na boko manya kirande buya na kirande bobe. Isa chine na bongo smile na boko manya my genuine smile and my fake smile. Seigo tiga ko tebati haya muntu yarenge buyamba kabuna irusetyo.
All right. Biya sana kwa letere example ekiyamono ekigo chigotwirira to tusukigo chimoto akatumanyanga inki o muntu oyo bwate birengere bine biyaga neri akore so that ko birusio to one way is through a book but ngwi katororo but daktari liboli ndirano inchengo chineboli na bere nkweboli ankakaga inchipika nkweboli until I saw ase inbox ya neko nabegete post edit tukoligoro ndaisa kubuli umuntu about suicide usendore ngama ene habwate birengere na kialiga is asking about suicide, putting the idea in that person's head. About suicide. Is me asking him, putting now it in his head. Yeah.
Actually, that's a great question, Sarah. And it is what you call it. Some of them. How no you know mnyagitari naro kura boli. Tote wo yotara to experience mono rio koiboli na ki. Na kipononda approach na kinda nguchikoboli omuntu yo kwanya kolenga likuirusi hapa moyo ata reactive band ata yabena kikwandra nchino omuntu tete kuirusi hapa moyo. So it is how you are going to ask the question na kyokoboli riswali you start from a point that the patient knows ebintu biri amanyete gocha ngora bono mpaka the unknown monege nto gocha kumuboli kwanye goikase getore buno bugima bwa korositi wararire yani you give leading questions kwanye yani buno uroche ebintu byokoreka kwanye goikase getore buno bugima bwa korositi kwanye gutwara feelings of hopelessness usewe gwatiore worthless kera kwa mubuli swali mubuli kera kwa tore feelings yeti ya worthlessness kwa tore birengara liye goro yo bugima bwago useko ikolere gentekebe then they will give you an answer. You give them a leading question about what banyene bakoleta. Usually when you go direct to the question wona tibunere seketabu kwanya kolenga likurusia kwa sometimes it can make them irritable. It can make a patient look at you na akoligerelia asenchere yerembe. So you got to get approach uko chaka kurua tambe kukunya gocha kunya koleta umuriro lyange egera ranore concerned na mangana ali agwetera binte gwetero bikon nki byako kolere kwale kwachakira kolengera libobe.
Right. Igonga you can put that idea in their head through the way you are asking them. Also again you can get that na boku manyanga those thoughts olengana ki okobakonya. Asante sana naende kero kende daktari mondona take kubolinga igonda nyokwana kwana take tuweita so that I can catch the attention of the people wasina bora nyanga kwana genuine liko lengere tukwekora. How do we kwa machuko kwana litangane but
you want to get kuita mono nateba among women.
Yes,
women will come with that tali isi onyore musacho gocha koteba bono ntegete kuita. Women usually they are asking for attention and this attention is genuine. Attention eba korangeli ne bwanta ko ba addressed umuntu kunya gukwana ntete goita igo muchando nore imyara arorire na achire ko batayimuri koyego bono ndigamba threat yo koirusya bamoyo. Actually giving suicidal threats is another risk of suicide. Ikineki manyerero bwanta koligereri umuntu yonko irusya it is a sign of suicide actually. Ikineki nto bwanta koligereri aseigo tigagoteke gente ko umuntu kunya ko batayintete goita ntayite goita ngake ya mona boko motokonyera bo matayibono 80 agenda itekegero no muntu bwate bintu bya muchandire na kiki umuntu uri buyata kunya gocha ko tayintete goita kero umuntu agusika attention immediately muchando no uri babwate either nyomba mbali kuibona na buya ebinte binge biragero umuntu ikachake gukwana iro.
Pia mono mwanchu muligerto na daktari Dr.Rodgers Omuya korwa Kisi Teaching and Referral Hospital to kwanera iguru ya suicide. twarorire ebikoro ebi biamentekanira sama tukagwanguiga and they are really concerned nkikiabeire naki twatigire gocheki on our neighbors, on our brothers, wacha kwajoranga igatugite nyumba gagweti kanywete sumu gesungetie nigagwate birengererio nobody came ondata chitia chikumukwanira because twarorire ngaki twakwanya abantu buna abaiga daktari nate abaye gukonyeka nkororo abakurunya gitari therapist chiro enjira nere bagukwanirwa so that you ponto kanyika birengererio kyagera ne tutarigere daktari nga nkiye kugere birengererio bibiacha twenda to signs and symptoms na risk factors by the way nkurigere litole that nga nkigera reasons umuntu achake kutwara this birengererio bi but before that mbale ndo chekega ba tumire birengererio byabo wetera se number ya SMS agoteba morning Sara salimia Sara salimia daktari sana ni daktari wangu anasema amenitoa mbali akoro kwa Pacific kutoka Nyanchwa asante sana Pacific otebere kwa murusiria tambi sana daktari na alitukecha machiri cha Nyanchwa ndoche mumanyi Jomo agotebanga wow so educative session say hi to daktari mnafanya kazi safi sana Ontita neta ya TV ngi masante agotebanga is enjoying the show kiagara is very very educative basi batanyole na endele taya mimi naitwa Janet kutoka Nyamira naomba usalimie daktari sana tunakutegea na wazazi wangu wasalimie tonta etimalieta ya Bible kulinde kurunyamira otebanga natobwate they enjoying the show so much asante na walimo kugendera kundikira gwetera Facebook live no tuligalia you can leave your comment egere tuyirigererie asinchira yubikira no kigima daktari nkikira yero montale ngereria about taking their own life
ambia mono sana Sara egente kenene kiriye kogero monto tware birengerero byo kwirusyo bomoyo use otwara suicidal ideations the major one nekero montare rebono I'm hopeless yani na temire mbakesi na ikire na ikiro mwelio na ikiro mwisho kene nkionda akore na nde bintu ne bingi biragero montarati okiro mwelio we ubugimo obuiga entege tangani togoteba are financial problems monto temire okwanire na bairi likirie bintu nande na bwatan underlying problem na bawe kabono altwale birengalie biga ndo what issue with relationships what breakups kona relationship inchire chiku break up in a very bad way bad way into what chi break up chaka waido montago tura igogenda babia but we have those bad ones ogero monto obote babono nchi oyonere na olenge tegemea so bugima bwane tindo chuko ningi andre no bugima so majorly we have like the risk factors chiro montago twara na chiku babeka monto ikorora bono na ikiro mweli bugima but again into kwa regular ya serotonin levels ya so bongo if that chemicals goes down kigenda ense mono bono monto yigatari gutwara in hope ngomono no wika stage ya hopelessness monto ikire stage ya hopelessness umekata tamaa kabisa and lazima outside help weche manyako konyo monto kiagera unatoteba ngento kere tokoteba if you try hard you can snap out of and so kotema monayo monyene na bukuru as depression was ebirengere bya suicide na obikuru wararo but in reality to konyara ebweka as monyoro monto oranyare ko bagako konya
to talk about relationships which is true as a lot of marriages usenonye boyfriend girlfriend but then how about young children yorora bana ba ke grade 3 grade 4 tuta mejihanga ndia manyigoro yo kwengeta rendi what could be the reasons for young children
actually the risk factor is high among this young generation people aged between 13 years to like 35 Kasitobekere risk suicide attempts chiremo among those ages here, youth. Early teenage youth suicide risk very high, and again in extreme of ages abantu bali bachire myaka emenge iso ya loneliness yokonyora bali boka bono mono twabulinki yakogera abana abakena barabu bakokorera ebintu ebiga ntubwate ebintu tokoroka buna advanced childhood trauma wose obugima buli abana bagwetera abakono wose non-functional families omwana okinira se familia bayibuli bakurwana bayibuli barabalebi bakurwana throughout wose omwana orolire omuntu kagokorega tendo kiri bono omwana oyo yeteire pain yeye osinyira kwenye manager bweka nando uligereye inkurigereye ari TV orore ebintu abantu bakora because nowadays our children are exposed to the world bintu byokoreka nensengi mamba biroche ebinabo bikuba beka barengera kurusha obamoyo batimoke especially battering of children advanced childhood events immunity rape umwana wa defiled karomoke umwana witu bono abiboli mbale they batter their children kumuita kabisa ntobwate abiboli bali bakurwana barabwa abanyene bako umwana uligereri it hurts them nande buna ukinonya tari konyara go solve gento keri at a certain stage of their life ngweka bali balengereri batwali bilengereri biko sabatwara mental problem those are among the few things bikogera abana babatwara usintu bwate siri abana babwata underlying problems to konete gro ya neurodevelopmental disorders bwata abana babwate antisocial disorders attention deficit hyperactive disorders actually into bwata abana bagotwara depression
depression
we have children who have depression to what abana bagotwara early onset schizophrenia buna twatwarete to akwanete is a chronic mental disorder ne nero na bikobeka these people at risk yokwirusya bamoyo
all right we need to be very careful na bible kiagara twarete abana abana bakesana wamejitoa why
bono for example tigango tebi you get a family where omugaka akunywa maru 24/7 mamu mwabonere nkunywara maru 24/7 at the end of the day abana be batigire barabubuka onye good samaritan ta ko Rwanda chaba enonye nindagira they're just there, so you can imagine the trauma omwana yago kina kabwate kira baburi bachire nyomba egentege tangane bakora no kurwana oyo buri oyo nkayikwarenge ayenka yikwarenge and then na fight yacha ebine bintu bikoletera abana birengereri ebibe nonye ni school mbali konyara go concentrate a trauma nero na bekurukuru ase school no mwalimu nero chaka kogote bingo sa yaba buri bago nabalebi kasi abo no kunywa maruka bali konyara waka na school fees bono compounding ebintu biri byonsi koko gende school waka go mwalimu ngo koirale biya kokwera nanka still it is the same environment harsh environment yare kogera abana babatwara these problems
all right mwancho mu ligerelia ndagete toragendo matimoko moke na daktari karatukwirana tuchigo kurira nga inki abantu abagwenete bakorerwe na inde na daktari yo kumulikira mangana ya mono mangana suicide na ndo manyete binte bimbiro rasorongoro gusi ense ya Kenya na globally inki yaro chege korwe so that we can at least bring the number ya abantu bawite kense ayo ngati yali tuchukwanera karatwara somo tubakomoke korwa sensemo inde ye studio gutuna daktari Rodgers Omuya korwa kisiti chingana referral hospital oyo kuligerelia mangana mange ya afya ya kiakili kiagara afya abantu bamanyete ne yo mubere but kuna afya ya kiakili ekerole biole stable na enda afya ige ko babira kine ko banko bwao monta tanga korala usingale karuete na abantu bagutumeka igen layman's language na arato kuligerege karto kuligere mu chando bwa abantu gutwali birengere byo kwikora na kwerusyo bugima tumese kuskare nchine onkoro kwa Sara Nyarangi Ontita ya nereta ya TV oburabu bwa gusi.
TV Omurabu Wagusi. TV Omurabu Wagusi.
Ana karudi train na ronga nenge take ya sana. Isa koja kwa ndara ye train nenge take ya take train. So I used to admire.
Money wise, I can say nganchale fair. Njale nge bobemono.
Isabali yane. Umurobelyo bugwe semia.
Ne command a directive about the ringa. Shoot to kill if there will be any resistance.
Ine nkaiba Ktrh. Nkaibale nande nkaibarochi.
Aba Air Force na ego ba ringa wantabo kisa. Nande ngwa join for Air Force ni to the jema tenguya.
Rua saving yoralia is a village boy. Lakini wana utiri mpaka obere ambassador. Kitu chikuri ili tukula lero atutavina na kikiro montabu ate sabali yae.
Exactly in 2014, that is when it was very clear in my mind that I discovered doing community work. Was an inner joy, satisfaction than as an employee in an hotel.
Breton Makori.
Ase sabali yane yagera asensei kiro montana bate sabali yayo bogima.
Aba ebi matu wakata Twitter.
Aba ebi.
Why you sit? This is an illegal assembly. Toga itwa. Toga seli.
Ano jengare waya itu wakuno ni jitia.
Toga iliwa nakana wewe na koja chose 2 days.
Kirali tukolia Jumatano ense munenu suchama rogoba. Imeyeta ya TV Omurabu Wagusi. TV Omurabu Wagusi.
Tuiranire na indo manchu mulire kura sansa mwende ye studio kara director ya itoa kura kwa Joshua kura sansa mwende ye studio tuara mwiriri baganero kolje bibere bitatu kara tukubatera na Thomas Ongoto nere kura sansa mwende ye chi camera Brighton Makoli era no ara rondiga is the first consumer wale na intugeiga ni Eliasu gete kando kidogo lakini nende na otole pamoja inyora nchino mwaziri boba chenu daktari ase Omurabu Bwetaya breakfast show na Brighton yako mwaziri wejisemi mangana ase Omurabu Bwetaya breakfast show pia mana sana anyoko bato ko bole chinga kina chechi gendra gutuma maboli yakiagera twachira sensemo yo mwelio kabisa agera tuchugo kungunta kabisa ko rasenkwana yeli tsukulia rero tukumulikira igoro ya mangana a suicide ngia bantu bagwitira kisababu nchiri chechi twachirolre ibimanyerero mbere biye byuraro reiga otabanga this sharp warning okwanero yo mino twabirolre the risk factor who is at risk Tota tinga wano balibarware tupo kana ubara at risk, everybody is at risk, everybody is a candidate, itategemea uta-handle aje situation yobwate. Mbala wabaganda tuko tuligiri gwetera senseme ye mitandao daktari akorokwa. Alright, notole with our very own akubolinga kani chronic pain and illness cause suicide. And by the way, I think we're on a little recognition in church itaboniga na bokuira neli amanye na inde mtu asome gazeti gete ya Daily Nation mongwana gete toka Romo mroli kwa miaka 28 years olio tageta konywe n'abanyagitari akwe kiagera bwata very chronic disease ya muchandire sana. Is it okay? Ego sabakolikuwa by the way tukaranya gitari wa bakandanga we save lives, we don't help in somebody to die. but wikira sata getakwe alafu bono yo boli biyanga do chronic pain and illness cause suicide.
Mbiamono Sara nandi mbiamono asomoligereria kwaletire another discussion to went kucho kwanirenga kiende ya euthanasia yo ko mass killing.
Yes, sure.
Woitose sori bakororera umuntu akororera mabira kwa kwetere pain kira nakona iguru ya chronic conditions usamarwira aliari sugu akobera for long ya somobere akogero umuntu onywa malioga nga kientambe. I think I'm going to mention some of them.
Yes.
Pain is among them. Pain is again nonye na kiro kwego muto ko gwati okwego yani nkinda anyunda ale muto yotige ko ngati. Pain is something on the one side tagetietere kira wate pain, especially body pain. And one of the conditions buno mumuro yego reko orengere tacho kora euthanasia wate to wata bantu bagotora sickle cell disease. Sickle cell disease ngochire ne crisis ke ko painful crisis, a very painful thing, very painful thing actually, because ya manyinga likera very sickle shaped kira weta se blood vessels ya cause a lot of pain. Yeah, actually normally ya manyinga went have a certain shape. Kinibono kira very shape where it causes severe very bad pain. Ere umuntu atanyare tolerate. Nakie kibako be injected with very strong painkillers. Pono umuntu what chronic pain na bawika ave addicted na maliogo the strong painkillers sasa ulina chako nyagotumia cha mukendi yake. Ese wo muntu menyete na chronic pain ngoikaro mwelio ngoikaro tebano ina malioga yangu ngobe tuna inchando siri. Yeah, so we have chronic pain, we have chronic conditions abantu babwate sugars bakwibete sindani kira lituko na ndikiro kwibete sindani, remember it causes pain. We have some other conditions yoko betu esindani tigana kalige sukari nagake nero muntu akobetu esindani to relieve that pain. Now a bigger one tokoroka anesthetic injections chare some numbness yagara muntu takoigu that pain. Aseigo pain can make a person think of suicide or think of euthanasia. And we have countries chigokora that thing kroku euthanasia. One razmo monta aimokaga and they use a lot of money go interview. But to us as health workers in Kenya, we don't, it is illegal to do that. It is against the law.
Yes. Yeah. All right, mbiamono sana, lakini the fact nearing chronic pain can lead to suicide. Mutarawa ikarengerelinga I better die. Libagali uko na gwitira obukongo. Asante sana Tiberius Omuya, our brother. So tubwati whatever. Good morning Sarah and Rodgers Omuya, Dr.Rodgers. Abasemia abwenge ncho kabisa. Following you with a pen and a book at hand. What is suicide? The risk factors, signs, asante rero akonyo muntu ndekero kororango muntu naro utalibya usenonye nanyo ko what are those thoughts taboko nyoranga this discussion ya okonyire egaro manyingi bintombiro. There is much more than the suffering we are going through. Bintombiro you will get out of that. Asante sana sokotobwatia. Can lack of access to empowerment opportunities and discrimination increase the likelihood of individuals committing suicide?
Okay. Yamono Sara, lack of empowerment. Yeah. Again, edita committing to the politika kulitumyake because when we say commit suicide, it means it's criminal. Yeah, we say dying by suicide. Or ending your life by suicide or attempting suicide. Yeah, I say again, tonda tebio murigerero ito. Lack of empowerment alone. Whatever there are so many factors chigo change to play montomanya ko end their life by suicide. So lack of empowerment nkaita araba minute not knowing bono buna obo manyobo to kwena no Ontita mighty about binto kibirageren to suicide thoughts. Of course, if we don't teach our people about suicide, most suicide rates will continue going high. But when we teach them that this is something they'll come seek for help. I think nabara minigo, but again discrimination. Monomonas opportunities tutebe ora se abantu gete bako ba favored gokobwaye.
Yes.
Because it will make you feel bad na bako garo ibubobe lakini ikiyo kwange ko garo irusyobo moyo lazima other factors change to play tutebe umuntu wate ocha konyo chande gito wate mechando gete na ande discrimination ya chire enya commentary ne bintu binde they are going to make this person arengere ko irusyobo moyo.
All right. Lucy Kemtobaba, thank you so much. Awatebanga following keenly from Kiango. Kiango ikalibura bugali umachoge burabu, I think so. Whatever you guys are doing a good job. Biamala sana baba ekiagerega si tunokurobo semia. This is the one of the 3 pillars chia omorobelio nga goika togo semia na ende tokomanye na ende tokogokie. At this time we are really informing you. At the same time educating you. Wirota manyete egere okonyeke no onyiko bwata muiri ko bwata mwana chakire ko BF bintu bine bitu akolere behavioral change bana boko manyanga something here abugo tiokerere mbeba you can smell a rat omanyanga things are not right here mbia mana sugo to bwata ne mbia mano ase ugoto ligereria daktari inkiorochege korwe so that kiagera go fight these suicide thoughts as abantu is not a small work. It's not a small task. I mean, nabo taikira niyo call. You are doing your best as an expert. Na the information abantu banyole, but you cannot do that alone. Because tokoba na ndo chobe kusengai tokunyara because na no mondo. What is your suggestion? What's your opinion inga? If this is done, na botoko konya abantu baito a good number na botoko nyaranga tuwaye konyire egere tusukibuzi.
Mbiamono sana Sara.
Yeah.
Again tukirinda atebe gitangani turanyare gokoregera tutange suicide. Number 1 no kugendera gokore oboseme buno beta TV gande takokora kera ngo ikira turabanta abange mali egera bamanya kumanya eyo no muchando turanyare kubakonya. So we need to do more of this kusomia abantu baito. Again tukende turakore. Another thing that we can do is to urge our government and some other organizations chikantri chinde ngutora chire suicide emergency response team. Yeah, nto wanta we establish an emergency number kiro montaña ro monto wa attempt suicide na kitoko mokonya. Yeah, kiagera totebe for instance monto wa attempt suicide gotumia lyogo lya ngombe there hours yo wanta komokonya etarachiko goike stage eliembe. Say go this rapid response team no kuganda ku rescue omuroiro yo mapema ale tunyegitari mapema anyare gokonyu and establishing psychological first aid centers in our sub counties. Sub county chetu chibwente gutwara a psychological first aid center asomo umuntu kera atwarire yani umayite omurwere nabagutaka agenda nyagitari lakini agoteba kingo chikota yo nyagitari uri atinde ngare tukwerusyo bomoyo na kiara ndengere
na kiagonkonya bo
na kitogoteba of course abantu mbare experts in this area but we have some other people that are still judgmental okobora gotaya itatore buyo begete yanga buyego ochagonte ati no bomoyo tete koirusi. So another thing we need to capacity build kusomia abantu other health workers agara bamanya na kibako handle these patients kirabachire igonto kwento kutwara na teba currently we have focal mental health person in every sub county but having them is not enough. Don't want to kubeka an area ebwate mpaka contacts munta waka for free obataini mbwato muchando bunoyo. Another thing no gokora more nekindate going out there in the field uhamasisho. Another thing is educating our children, taking this mental health and suicide talks into schools, because abana bakira bamanyire nchenkoro it is easier for children to teach adults. Kero mwana igurege ntongo kebekale mona sobongo kubwa forming mental health clubs. ST school mono bikoro kubuna hope squads. Hope squads are a group of people, students, how to instill hope among those students that have lost hope. I remember there's a school around here that had suicide cases, a primary school actually. I think it was our first school to visit, Kochaki. Those are hope squad clubs. Asabana bali baketua somiri like 10 of them. They can now be trainers of other people. They can actually counsel other students. So we are planning whereby these mental health clubs can be coming together. The reason we are doing this, this is just something normal. We want to have the mental health talk everywhere. Tigabantu bakwa na mental health bunoborwere barere egera stigimeli ruororo egera abantu bache open up bache nyagitari omoite boni go mondo na bagocha general ate ebe moroiro yo ito bwangire gocha wodi 10 kegera rucha abantu bagotebere no ne bali muno chomororere mutugaiga, and that's what we want to end. Egera abantu bamanye Ward 10, the psychiatry ward is a wellness ward. Na wako genda kwenye orowe chenu bwobongo gose ochake kobabuya okwanirwo ochake kobabuya. It's not a ward for mad people.
That's a very good opinion, Daktari. Nganki kerege korwe onye tutagete tukule these suicide cases. In fact, yagara na agree nechi proposal mobwatenga tiga onye county government facility chiwenete kobororo facility boronge chibe kuororo equipment, all that you need as a level 1, level 2 and level 3 chirichira se county government na level 4, 5 and 6 na chirichira se national government facility chibororo, so that yakaro monta wocha na boko mokonya netaban suicide yoka neba health services kwa jumla marioko ta kubora barwaire, so that yabarwire banda banga igete lioko diria mwe wena ta mokonya kwa nyoranga ndio. So I agree with the abanyagitari chi proposal babwate, so that it is okay na the intentions are well. And then I feel like ngochitortuara mental awareness, you mental awareness month. I remember you had it.
Actually, even May is mental awareness month.
Mental awareness month.
Yeah, we have activities. Actually, this month we are planning to have a marathon. And we are asking actually for well wishers. We are having a brain run, like a heart run.
Yes.
A brain break. Totimo kioba ongegere tokora marathon yogo create awareness in Kisii, in both Kisii and Nyamira County. And we are going to do this in partnership with the county government of Kisii, the Kisii Referral Hospital. And there is this organization yokoro kugusia mental awareness ya chage tukuna bantu bali diaspora. Nero ya to support last year we did a very big thing in May, and then the World Mental Health Day yakoba 10th September, World Suicide Prevention Day yakoba Nero October. World Suicide Day September, and then October World Mental Health Day. Johnson yakoba 10th of those months, September and October. And this year we are praying that we do bigger than what we did last year. Big. Because remember, again to tent as a county government treasury, tukabeka chitenta as Kisii Teaching and Referral Hospital, was screen our staff. And actually from the data we collected, our people are suffering in silence. Our colleagues back Kisii County abange to screen it, but we never took their names in confidentiality. They had so many issues. Into what the screening forms PHQ9. So many people are going, but others came forward after the screening, treatment, and most of them are doing well now. And actually the leading cause of mental disturbance Kisi county workers was economic, financial constraints and some other reasons. Alcohol and substance use problems.
Of course, na taba colleagues boka. Everybody else is financial constraints. Unaora orengera think about sukari. Think about magutanyin. What facilitates these things is money. When you don't have money, and once you are at
but risk. Still you can have money and have a mental health problem.
Yeah, that's another one.
You can have all the money in the world
and still have
you lack
a mental challenge. So this is a collective responsibility. If you can ask me about my opinion, and I feel like up to May, let us do this as a continuous thing.
Yeah, actually, we have every month, we have a mental health calendar every month. The what activities on your kwaroche, to agenda kisi special school, to agenda gana kekoro kwe ya vana manga. It is like a prison ya watoto wadogo.
Yeah. Manga, neri manga ali
school for approved school. We were there. So nto bwate kero mutinyi no bwate a big day. Kile month ne bwate a big day. Nto bwate no nye World Autism Day. No kwanira abana ba bwate autism. So every month has its activity that we can do. But we usually May we do big because it's known for that. Actually no nye conversation chinde chon stogo tuara. When you are sitting taking tea to atore conversation ya mental health. Yani again tekekeza kwa normalize it tokwane like this is an illness like another illness tutasaidia watu wengi sana.
Right. Bia mona sana wanchu muligeria tuli na Daktari Rodgers Omuya tokwana mangana maya nonyekara mangana a suicide ngakito ko get out of those thoughts kiagera mwanya bantu no bakorengereria mwanya bantu stress na bogutwara but stress nero daktari atatinga tetaniga because you have a lot of stress nkwendere depression nkwendere bintu bingao ngorengerera mangana yo kwerusia obugima singincho yoko kongero kubugima ondeta iyo keroche ne lingana kyo approach a situation na kiyakobera if you have these financial problems Kyoko get out of that. Totally problem yoka. Rona and the solution.
Financial problems chiro. And most people have we have financial problems, but you can talk about people living within their means. Actually what brings financial problems is poor management of resources. Onye kwa tige twega sio umushahara ogomanyete noyo. Tikakogenda beyond that salary. Kutotebe okwenda bwaka ne nyumba ya 15,000 kuwaka no mushahara 20,000 and then hiyo itakuletea shida. Yeah, so we should learn to live within our means. Have naboto kugenda for financial management. Mtobwate actually free courses. Chigota swamigoro ya financial management na zitatusaidia sana ku overcome those financial issues that we have.
So that we limit producer Joshua kana bantu bani mbaro konyara bakuongerwa ngabona ye bwite I don't know Koroterwa te bankororo mwanya bantanera
mwanya banto I don't think kinkero ororo but kirogo chaka ko believe what abantu ababono bandogire that's when you get to that because I believe muntu takonyara kondutera suicide
sure mono Lusike muntu asante sana gotabanga auntie yangu amekuwa na stroke for 11 years which actually led to other complications so mostly anadependia watu most of the time but imefika mahali she seems tired na hataki hata kunywa dawa zake. How can we help please daktari? Oyo Lucy oyo tubwate tukochisa macha kiango.
Mbia mono sana Lucy and pole for what you're going through and your aunt we wish her a quick recovery. Sometimes unatwata abo muntu nabawe kanywa mali wambaka iwara morosiri. Nande sometimes umuntu na abantu bali chikyateka na barabuna bagwika barosa kulinda umurwire for that time
for a long time.
What usually they need therapy. They need a good counselor to instill hope in them, both the family and the patient. So we'll start with the family first. Kere family kire ya rosire ngo ikabali bayi babakwana mangana gitatalia maya. Guseba ikabachaka kotonyera nonyo no muroire. Ebintu biri na bitoko takalita ngani twalete family yakora counseling, good therapy, but what they can do with the patient. Kere family anyore therapy. Now we come to the patient. Yeah, we start talking to the patient. Kiagara onyo what a stroke is the patient engaging in another activity. Yeah, stroke nerelia correct weakness idea. If this one side is not functioning, this other side is functioning. Are you putting this functioning side into end use? You have immobilized the patient there. Yeah. Oyonaba umoroiro on the ones of what disability. There are other areas of what ability. So we identify the areas of strength of this patient. Tuachaka kuchitumia agarachiarete umoroiro your hope in life. So there are things we can do. But now this is a family thing. All the caretakers bali bakwirero umoroiro. Actually umuntu okolenda umoroiro for long. They need therapy for at least every month. They need someone to talk to. Kiagara no nyina yo kulendo morere nkoboro overwhelmed. Nkorosori. Bono egere toro samba ko chake go ikasege to kwango moroire, you need counseling. Ikombe abacha bakoro counseling.
Yes.
Egere banyara kugenda kulendo moroire oyo bia.
Right. Bia mana sana baba Lucy. Enime to kulendo moroire daktari kama naweza ongeza kidogo na bom meto moroire oyo Obelje segasero for 11 years ina matuka mange nera bana mwanya bantoro baibwete ngaga kinkie ke bono nchina akorete so they lose hope very quickly ona iria kwa kunyama lia kwa kabere gatatu wachakira ko masomera wachakira ko lose that impatient akitoka tabranga the caregivers they should be very patient no morwiro oli kaba mwebereri onye no ko motereri omotereri onye no ko mwebereri kapiso mwebereri onye no ko mosisiki amongo mosisiki mpaka anje kunywe eliogo.
And the caregiver should come for therapy because it's not an easy thing.
It's not an easy thing.
So we also thank them as much as Bawi Kabarosa, we commend them for the good work they do, but they also need therapy. Especially Montokolendo Morero Wate stroke, Morero bedridden, also Morero Wato Mochando Wabongo, they really need to come for counseling. It should be a routine thing.
Okay. Once a month, twice?
Once a month. Okay. Once they're okay, we can do it even 2 monthly.
Okay. Bia mono sana. Walter Rioba, Kuruembakasi, Nairobi, agoteba niko ndani ya show. Asante sana mwensipi walimu atumire ujumbe chino guchagiga ase studio kobolia na gopongeza umurubiri gwili tukulia lero asitwakwanira mange iguru ya mangana a suicide twarorrenga na ki birangeli bigo chana kitora bikole batire daktari okolera bono kwanyolera abantu bali baletru aba baisaranse ta now I want you to talk to them bali babwate those thoughts so that talk to them so that they make sure they have gone away. Ndora one way from the example what you can do what you love most. That is one. But now speak to them. Speak to them, give them hope.
Mbiamono Sara, nande mbiamono Sara ligerelia. So on the ones you wetero mochando, usebiranga libyo kwerusyo bamoyo. Chinga kibune chibona toko kwana nyuma itembaro abange batoligereti ba temire sana kurwani eviranga liebyo nanonye kwatemire kubirwani we congratulate you because you are doing your best kobabia lakini kento naba encourage mbate abimbuna de omuranyara kwa moko twarabokonyi nenchere ntangani twateba no kuligyo monto liwegenete oteme ko bagoko mukwanire eviranga libiri twateba a problem shared is half solved. Karawa kwaniro montoyo onyo ndete yo bwamineti ase kenyorukia gare yenda to the nearest facility embo gucha sub-county hospital na rororo kenyenya sub-county hospital na the nearest church na bokwana no mu pastor na bokwana no musasiroti ndabwensi bwe kanisa o trust it yo maitora kwanire because yega ntotoko always our confidentiality kera to kwande ibintu ebi agenda isko ase igo obokonyi mborororo nayo bono tigare toche you open up Tiako bisemi chande yonsi obwate, open up and you are going to get the help that you need.
Okay. Pia wana sana mwahirwe some hope nga ogokonye kankorororo talikirige ntobono yakumiga ayegwa kiresabu nga ninyengenta mbya so ekarukwe ngenta kenenke yo kwamendo gogoere togende kero muntakoli mutobya so bali baguchandika abana bawo no mugako no mungino ne amati yawo so do the right thing get nyagitari rorachi experts Dr. Omuya no ali general all the time na ende ngwatendera abantu bya so ninchokali gwatendu bya abantu bande lakini Pacifica Korinyancho nate banga you are a very good man inju all the time posio tuligeregeria to kwanira mange na daktari nene na abwate meroberi yae neye it's a very big honor uchagega as studio kusanga nayo mwanchu muligeri kyagera eyo narenchera ya mayo give back to the community or say to the society. The bottom line atebanga tubwatera na all of us county government, national government, stakeholders bonsipi abana familia especially karumu watu muruiri osomonto teto kolengera suicide karumu watu atebenga mubaro opungusire kidogo chakire koira na globally. Daktari engana yawo yo mwelyo nimete wiko kwa ni mongina mamumino okwa ni mongina oyo wanchira okwachaga you look so neat nera butambe tunamraisi.
Asante sana Sarah. Asante sana Etaya TV and all the staff for inviting me kucha gutwaru muyegoyo. It's also an honor. It's always a pleasure to share with our people. Kiagera eyunare nchira yo katuranya rego konya abantu baito. Ndarachi kokore gento ndate abantu baite sibale. Mono bali babate suicidal thoughts. Wasaba go battle and mental problem. There's some do. Number 1 to atebete join a support group. Number 2 join an exercise team as more agenda macro exercises because exercising couldn't kororo montoba relieved mechande yabwate and then open up mono to our men into kerito ta man up into tagetiko igugo our men should open up kina kiongote yaba sacha baito kira watu aromo chando get someone get a friend that you trust bachiba kwane goichagwa kwanira yemechando yabo sege kina abatebiri ukorera tigankwa ni familia ne my wife Virginia my 2 girls my 2 beautiful girls Camilla and Chloe my mom Helen and my dad who is admitted at Ram Hospital. Wish him quick recovery. Francis at Ponaraka and then my siblings wherever they are. I want to greet them, tell them that I love them so much.
Tiberius, unapendwa sana na kaka yenu.
And to my patients, to all patients that I'm seeing, I love them and I'm always there for them. Whenever they need any support from me, I'll always be there for them.
Thank you so much Daktari asogocha ase studio nasogwanjo gukwanera umwanchu muligereria bange baligereria murubuna nimbagenda tukuligereria ngane bakire nechinga kichike bago lakini barorenge nkwane neyenge jukege masante sana waswati Virginia se botambe asoko banga Daktari kurinyoba na kama meki abia it's okay matumo muganda bagoche riskioli kalege nchiragete lakini rende you are doing amazing mungina Eleni asante sana asoko singe na muga 3 minutes tumemwishia quick recovery na barwiri bali bonse bara admitted asenye gitari yo mubuyene asubango etwalenge no yeminto Brighton Makoli etokweroka Twin Empire yetaya TV yetaya breakfast tokubatera na Thomas Ongoto Brana Chaka amo na Joshua Auta kwene kyagombo robiro yikiro mwanchu muligeria asenchiringi ya kigima twara buligeria borobya tyatokolera bwa asamambi aserero mambya neli tukolie chisemi tokataba Education Wednesday oyo minto mwaziri bw'ekisebya somoro bw'etaya breakfast show nere Brighton Makoli atakuwa papa hapa nere kera kuligereria ngangaki amangana y'ekisemiale asense ya Kenya engima nchaserero byangikeria bwo asebono twaro buligereria borobya Daktari bokuirana irana bya na ende butande karato kurangeria thanks for honoring the promises you watch twara buligereria borobya nche nigonkuru kwa Sara Nyarangi Ontita.